David Sanchez, Chair of the Advisory Committee for Resilient Nevada. And I'd like to call this meeting to order and ask Garrett to begin roll call of our members and establish quorum.
All right, thank you so much for coming today. Today we'll start with, is Jessica Barlow here?
Good morning, everyone. Jessica Barlow present.
Awesome, thank you. All right, next person, Brittany Collins Jefferson. Okay. We'll go ahead and mark her now. Next person, Lanetra Grady.
Good morning.
So, good morning, Lanetra. All right, next person, Ryan Gustafsson. Okay, next person, Dr. Farzad Kamyar.
Present.
Thank you for being here, sir. Next person, Carissa Loper. Okay. Next person, Catherine Loudon.
I'm present. Thank you.
Next person, Elise Monroy.
I'm here.
Good morning. Okay, next person is Darcy Patterson. Okay. Next person is Jamie Ross. Okay. Next person is Pauline Sala.
I'm present.
Good morning. Okay. Next person is David Sanchez.
Present.
Okay. Good morning. Next person is Ariana Saunders. Okay. Next person is Cornelius Sheehan. Okay, next person is Malika Totson. Excuse me.
Malika Toston, present.
Good morning. Next person is Dr. Carla Wagner. Okay, and last but not least, Quinny Winbush. All right, David, that concludes our attendance.
Thank you, Garrett. And just to confirm, I wanted to make sure that Brittany, or was it Brittany, or was it
Lanetra Grady.
Lanetra Grady? Are you here? Just to confirm.
Yes, I'm here.
Okay, good. Sorry about that. I just didn't know if we had the right person when we called your name, and I wanted to confirm. Thank you.
Thank you.
Chair, this is Dawn. Ryan Gustafson has just been transferred to a presenter. Ryan, can you state that you're here?
Ryan Gustafson here.
And Brittany Collins Jefferson was logged in under an attendee. She's logging back in, and we will get her into the presenter role in just a second.
Perfect. I've got Brittany Collins Jefferson here and Lenetra Grady here, as well as Ryan Gustafson here.
Thank you, Garrett. Thank you, Don. I believe we have established quorum once we get a confirmation from Brittany Collins Jefferson. And we are ready to move forward with this meeting. Before we move to public comment number one, agenda item number two, I'd just like to mention that it is important for committee members to have their camera on to ensure that we have attendance and committee members actively participating in the meeting. I understand that there might be some bandwidth issues or technical difficulties, so I will keep that in mind, but I will ask that committee members do as best they can to have their cameras on during the meeting. That being
Chair
said,
Jessica Barlow here.
hey Jessica.
I'm going to be working on getting my camera on, but I am having technical difficulties with it at the moment.
No problem at all. Totally understandable. I think it's pretty common and relatable at this point that one of us is going to have some severe technical difficulties. So we'll do the best we can with what we have. Moving to agenda item number two, I'd like to open the floor for public comment number one. During this public comment, I would ask that people be considerate of others who may wish to provide public comment and avoid repetition and limit your comments to no more than 3 minutes. If someone is going to provide public comment, I will be keeping a timer to keep things moving forward, and I'll keep that at 3 minutes. Just a reminder, no action may be taken on a matter discussed under this item until the matter is included on an agenda as an item that is an actionable item. Do we have anybody available or interested in public comment? And I see Don has a question.
Just wanted to let everybody know that Brittany is on. So Brittany, if you could let everybody know that you're here.
Good morning, I'm here.
Good morning, David. Sorry, it's Carissa Loper for the record. I am also present.
Thank you both. And just to confirm, so that it's included in the minutes, we do have quorum, correct? Garrett and Joan, just
Yes,
again,
we do have quorum. Yes, we do have 9 people attending.
thank you so much. All right, did we see anybody available or interested in public comment for agenda item number 2 at this point? I don't see any hands up, or I'm not sure if I have the ability to tell if there's someone wishing to speak as part of public comment. It looks to me like we're clear, but can I get a confirmation from Garrett or Joan that public comment number 1, there is no one interested?
I do not see anyone interested.
All right, thank you, Garrett. At this time, we will move forward to agenda item number 3, which is a discussion and possible action of the approval of the minutes from our October 4th, 2022 meeting. This was sent out a little while ago. Does anybody have any questions or comments before we get a motion to approve the minutes from our October 4th meeting? All right, I briefly went over it and didn't see anything myself. If we have no questions or comments on these minutes, do we have a motion to approve the minutes from our last meeting?
This is Elise Monroy. Chair, I did not have any questions, and I am happy to motion to approve the minutes from the October 4th meeting.
Great, thank you so much, Elise. I appreciate that. Do we need a second, Tom?
Yeah, this is Carissa. I'll second that.
Thank you. It's been a little while. I just want to make sure I'm not missing anything. Thank you. Okay. So at this time, we will take a vote to approve the minutes. And all in favor of approving the minutes, can I get a yay or a nay?
Aye.
Hey, David, it's Carissa. Let me just, how about we call the ayes first?
Okay, ayes. So yes, so can I get everyone in favor? Aye, please.
Aye.
Aye.
Thank you. Any opposed? Okay, good to hear. Any abstaining?
Jessica Barlow, I'm abstaining because I was not in attendance.
Thank you, Jessica. Looks like we have a vote to approve the minutes from our October 4th meeting with everyone but one in favor with an abstention. We will now move to agenda item number 4, which is an informational an update from myself, the chair. I just wanted to touch on the updated committee members. There were a couple people who resigned from the committee and a couple of people that we added to the committee. The people that we added are, I believe, in attendance today. We have Jamie Ross and Malika Toston, who are our newest members of the Advisory Committee for Resilient Nevada. I'd like to take a minute and say thank you for everyone that has been involved and that continues to serve on this committee. It's been a wild ride, but I believe we are making a meaningful contribution to the litigation funds from the opioid settlements and helping Nevada find a way to kind of recover and get through what that devastation of our community looked like. I also want to mention that we have an upcoming cross-sector task force meeting on June 26th. This is the meeting with both the Surge and the ACRN combined to come up with some strategies and implement some actionable items that can help the community as we experience batches of overdose from opioids. And I hope to see you all there. And again, appreciate your commitment to showing up for this committee. That being said, we're halfway through 2023 and we will be moving forward for the rest of this year, hopefully meeting every other month and really getting prepared for 2024 when we have another report due to the director's office with updated recommendations or adjustments in recommendations or to really get an idea of where money has been going. Is it working? What do we see that's working? What do we see that needs to be adjusted or areas of concern that are not being supported? So I just ask that you keep that in mind, that it has been, again, a wild ride, and we have some more to go. So our goal is to remediate the harms from the opioid epidemic and use the litigation funds or help guide the funds from litigation with the opioid companies to implement programs and practices that'll support our community, help them recover from the opioid epidemic, but also slow down or help support folks that are still suffering from opioid overdose and addiction as a whole. So as far as an informational, we will be going over in this meeting how often we would like to meet moving forward, and we'll give an option for either every other month until the beginning of 2024, or we can do every 3 months. And in that time, what we're planning to have is updates and, again, presentations, which I know can sometimes be tough, but it will give us a look into what has been distributed so far and how it's affecting or supporting our communities. So I think that's going to be important. And I would just ask that committee members do the best they can to stick to this commitment and show up to those meetings so that we can all be on the same page. We are a part of this committee as subject matter experts in different fields. And I think that showing up and representing those different fields is going to be paramount to getting the community the kind of support that it needs to really make it through this mess. Just a heads up, our committee members are coming to the end of their terms. We serve 2-year terms on this committee, and September of this year, at the end of September, that 2 years will be up. So I would ask that you consider, if you're still able and interested in serving on this committee and keeping to the commitment of showing up for meetings, responding with feedback, and really consider, do you have the time to be here, and do you have the interest to be here? And either way, know that you've contributed to something that is meaningful and that has mattered, even with the ups and downs. So if you plan on continuing to be a part of this committee, I would ask that you email Garrett Goodlander, who is now one of the state admin support members for this committee. And I believe you all got an email from him, a couple of emails from him in the last month or so. So something as simple as, I would like to continue being a part of this committee in the role that I currently serve, or I will no longer be able to commit to this committee and will need a replacement for my position. So again, today we have updates from Don Yohey from the state for the Fund for Resilient Nevada, and we have Dr. Terry Kerns from the Surge Group, and they will be giving us a couple presentations. We'll hear from the State Opioid Response Grant, and then we will come up with some plans for when we will be meeting and what that will look like for the rest of this year. I'd like to open it up for any questions or comments before I move on to agenda item number 5. Anybody? All right, I don't see anybody. Garrett, can you confirm we have nobody on the committee interested in comment?
Nobody is interested in comment on item number 4.
Thank you, Garrett. We will now move to agenda item number 5, which is an informational, and it's the update again from Dawn and Dr. Kerns. Dawn, would you like to take the floor?
Sure. Hi, everybody. I don't necessarily have a presentation, but just wanted to give you guys a quick update on where the fund is at. So in the last few months, Attorney General Ford announced a few settlements, including Walmart, CVS, and Teva. CVS and Teva were the larger settlements at $151.9 million with CVS, and then $193 million coming into the state from Teva Pharmaceuticals. Those amounts will be split between the state and then the one Nevada signatory, so I can get you guys an official number. It comes out to be about $66 million from CVS that will come into the fund directly, and then a little more than that for the Teva Pharmaceuticals. We did run a notice of funding opportunity that started March 1st with 6 target areas specifically for behavioral health treatment, as well as criminal justice targeted populations. So the targets, there were 6 target areas, which included increasing the availability of evidence-based treatment, expansion of adolescent and transitional aged youth treatment options, increasing access to evidence-based treatment for tribal entities, increasing availability and access to medications for opioid use disorder, increasing treatment for neonatal abstinence syndrome, providing opioid prevention and treatment consistently across criminal justice and public safety systems. We received 13 applications. All of those applications are going to remain in our files for the next 4 years for potential funding. Out of those 13 applications, we did send several of them over to the Bureau of Behavioral Health, Wellness, and Prevention for potential funding, as well as the State Opioid Response Grant for potential funding. We are funding 4, since it was just a very small amount of dollars that we had at this time. We are focusing on target 1, 5, and 6, which is increase the availability of evidence-based treatment. We are going to be working with Living Free Health for frontier treatment and transitional housing in Pahrump. Target 5 was increased treatment for neonatal abstinence syndrome. Roseman is going to be funded at this time for the Empower Rise program for the recovery, integration, support, and empowerment. They will be seeing pregnant persons, as well as developing a curriculum that we may be able to replicate statewide. And then target 6, provide opioid prevention and treatment consistently across criminal justice and public safety systems. We're funding the Carson City Community Counseling Center Regional Wellness Center, and to increase beds there, as well as the Department of Alternative Sentencing STAR program. I am looking to pull out additional treatment dollars at an August IFC so that we could fund a few more providers out of this NOFO. Other items that are currently going to be funded, we're going to be working with our Department of Emergency Management to assist us with purchasing handheld mass spectrometers, which will be 2 per county, the devices, as well as the kits, and the training of how to use them. We are going to be funding a pharmacist conference in October. Dr. Slamowitz is on if we needed more information about that. We are funding rural county jail-based MAT MOUD treatment options for incarcerated individuals. We're working with former Captain Bill Teal from Metro, and he is conducting a survey of all of our rural county jails in order to get a holistic picture of our jail-based programs and what some of our jails may need in regards to incarcerated patients. We're funding an ODMAP API through DPBH, the Division of Public and Behavioral Health, as well as a portion of the Poison Control Hotline. We are funding a position with our Office of Analytics for a biostatistician, a tribal commission liaison / opioid coordinator, specifically for our tribal community members. Our joint commission has dollars set aside for the prevention of overdoses. Again, that'll be meeting at the end of June here. Vending machines, syringes, and supplies. We are going to be funding mobile MOUD for the purchase of vans. Some future training items include, or some future funding items include, a training and technical assistance center with opioid coordinators for statewide technical assistance. ASTO projects, including ECHO projects. We are funding a multi-tiered systems of support to include opioid education, additional naloxone purchases and distribution, fentanyl test strips, xylazine test strips, reporting software, and there's just so much more. But we're really working through our state plan and trying to be very thoughtful about how we're going to be using the funds, how you guys want to, how you guys have recommended the use of the funds. So it's just a starting point. We are going to be having these dollars and these conversations for the next at least 18 years. So, Elise?
Awesome, thank you. I have 2 questions. So I'm really glad to hear that you guys are purchasing the syringes and the xylazine test strips. I've been on a number of calls in the last month where we've talked about xylazine specifically. We're not seeing it sounds like, much yet in Nevada, in overdose deaths, but I'm sure soon it's going to be making its way out here. But I have a question about so if you guys are using the money for, if we're using funds for purchase of syringes and xylazine and naloxone, how are you getting those things out? Like, is there corresponding money to contract with an agency for distribution, and what does that look like?
For the naloxone, the xylazine, and the fentanyl, that all is going to be going to an August IFC. I'm assuming we're going to be working through an already open subaward with CASAT to assist us and the Southern Nevada Health District to assist us with the distribution of those, since they are the facilities that are already doing the distribution and have those partnerships. As far as what was the other one? Oh, the syringes and the vending machine supplies, we have an award for Track B because they are the ones who own the vending machines.
Okay, so that sounds great and completely, I think makes sense in terms of like what I understand the state's process to be. I'd like to make sure that that as we're thinking through a distribution plan, that we're thinking about how we're going to get things distributed in the north, in Washoe County specifically. So that's just something to keep in mind. And then the other thing I have, it's actually, I think I just need to register like a concern. But specifically about the handheld mass spectrometers. I'm very concerned about where the state of Nevada is from a policy perspective on using testing data to criminalize people and not using testing data to prevent overdoses. Specifically, as a result of the Attorney General's fentanyl bill, I'm really concerned with where we are at. I think that any effort to give local law enforcement the ability to collect data about the drug supply we should prioritize that data be used to curb overdoses, not to arrest people. And my fear is that those mass spectrometers will be used to arrest people. So I actually have a lot of heartburn about those mass spectrometers. So I would request if we could get a presentation about what the distribution of those is going to look like, as well as whatever sort of policy or agreement is going to be created if we're giving them to local law enforcement. Again, our job is to prioritize remediating the harms, and I feel very, very strongly that increasing penalties for things like fentanyl does nothing to reduce overdoses. It just increases the number of people in jail. And any effort that is just seeks to criminalize the population that we're trying to serve hurts them and hurts our work. So I'm very concerned about using giving out mass spectrometers. So that's the only thing that I'll register, and then would request just a presentation on what distribution of those is going to look like. Thanks.
Yeah, thanks, Elise. And this is Dawn. We actually had this conversation too, because this has been brought up several times. And so I think a group session around allowable uses and standards policy is definitely something that we are going to be putting into place. Just some of those guardrails so that it's not necessarily constantly about persecution of an individual, but really about the overdoses and trends.
Thank you so much, both Dawn and Elise. And yeah, I'm glad that you've heard a lot about it or heard responses to the concern. And Chris, I will grab you in just 1 second. That whole remediating harm, and then part of the recommendation to have these mass spectrometers out there, if we don't intervene in some type of way, it's going to be a compounding harm is what it'll end up being. So I'm glad that the processes and policies will be looked at. Dawn, I just have a question about that. Will this committee have anything to do or need to respond in any type of way to help guide what those safety bounds are going to look like as that moves forward, or we're already good because we put into effect that we need the mass spectrometers and that'll be funded?
I'm not sure. I think you know, like what we talked about earlier, is we are going to have to pull a group together of some experts, including probably Dr. Kerns, and really talk about what those policies are going to look like surrounding possible criminalization of these devices. But like I said, go ahead, Elise.
Sorry, Dawn. I just wonder if it wouldn't make sense to leverage the surge working groups to do that. I know that there are a number of subject matter experts on data collection and implementation of these evidence-based overdose prevention strategies. So maybe that's an option that you guys can consider, is using that structure.
Great.
Thank you, Elise. Thank you, Dawn. Carissa?
I was just gonna ask Dawn if the division or the program has intentionally included evaluation measures and outcomes and an evaluation plan for some of this. To your end point, right, we're going to do this for the next 18, 20 years with this funding, but do you have short, intermediate, long-term goals that will help us drive the funding as we see outcomes from various funding initiatives?
Yes, I do have a quality assurance specialist working with subject matter experts nationally who are also distributing the fund to develop some of those evaluations and reporting guidelines. And so I'll have her come to our next meeting and show you guys kind of what we've started to develop.
Thank you.
Good question. Thank you, Carissa. And thanks for your response, Don. I'm glad to hear that there is a quality assurance person. One thing that comes to my mind when I think about quality assurance oversight and accountability is that they're super limited. A lot of times accountability and oversight are limited by the fact that that's the only treatment that exists. That's the only intervention that exists. So to shut it down would cause more harm than to somehow figure out how to line it up to meet the expectation that it was funded for. So hopefully we can avoid this problem of aiming to help while causing harm is really, I think, a heavily weighing on a lot of minds right now, being that we were a part of helping direct the funds and where they would go. Dr. Camera?
I guess a comment I would make for just sparked my Don had mentioned the next 18 years, sort of future forward thinking. I feel like the focus has been a lot on fentanyl in the past, let's call it a couple of years, because of the skyrocketing deaths, right? But when we're talking about sort of what does the future look like, I think I don't know is a good sort of summary, because we've seen it, right? So fentanyl was oxy before, and then it'll be carfentanil, and then it's xylazine mixed in with this and XYZ. So just a little bit of when we're thinking of implementing these mass specs or just whatever it is, fentanyl testing, XYZ testing, sort of having this notion of we might always be behind the 8 ball when it comes to these very specific testing. And if it's not really helping, Elise had mentioned this, in reducing overdose, but just sort of data gathering. Well, we know everyone's overdosing on fentanyl, for example, now, right? But in 2 years, it might be everything is xylazine and carfentanil. And some new, absolutely ludicrous, right, synthetic that's being produced. We might be wasting, I don't want to call it wasting efforts, but let's just be cognizant, right, of maybe what's best to move forward with something that is universal, focuses on really some data, some alerting of, because we have that cross-sector task force on, hey, we got to move to action. Here's what's kind of going on, but not getting lost in the details of let's invest $7 million, for example, on this one thing, and it's going to be amazing at testing fentanyl, right? And then in 2 years, it's kind of right, not applicable or less valuable. Anyhow, something along those lines.
Thank you, Dr. Camera. Yeah, that is a good point. I know for myself, looking at the impacts on underserved or underprivileged or historically what's the word that I'm looking for? Disproportionately affected folks is always on my mind, but also if I can keep that in combination with how is this going to look in the future instead of being direct and specific to something that limits us, to keep it open and available to adjust to the times. I'm glad you brought that point up. Thank you. Garrett, can you help me out? Is there anybody else with their hand up at this time? Or are we ready to move forward to Dr. Kerns' presentation?
I think that we have Dr. Cameron still has his hand up, but I think we're good because we just answered his question.
Cool. Thank you so much, Garrett. Thank you, Dr. Cameron. Dr. Kerns, when you're ready. Or Dawn, you're all good, right? Okay. Dr. Kerns?
Thank you, Chair Sanchez, ACRN members and staff. I just wanted to provide a brief update on what's going on with the surge. I don't have a formal presentation, but we'll just go along and entertain questions as you have them. At the beginning of the year, we started the year by basically formalizing and approving our annual report and submitted that to everyone that was required to get it, such as LCB, the director of HHS, and others. And it had our recommendations from each of our groups. And we did kind of put them in different areas, and we put which of our subcommittees came up with those recommendations, because we did have some recommendations that were cross-cutting. If you haven't seen that report, I'm happy to send it to anyone. I know I've sent it to Dawn and Joan, so they both have them, but if you would like to see that, we're happy to push that out. We did have some committee member changeover as well within our group. So we brought on some new members or reappointed members whose terms were up. Because on our subcommittee or on our committee, we do have legislators. On our subcommittees, the legislators weren't part of it for the beginning because obviously they were very engaged with the legislative session. So our subcommittees, which are the prevention and harm reduction, the treatment and recovery and response, have been meeting. They meet about every other month. And that's really where the majority of the work within the surge gets done, at that subcommittee level. We've had 2 general surge meetings. The first was just kind of to get everybody back on board. But one of the things that we did as a recommendation of many of our committee members was that we had a full surge meeting that was focused on harm reduction. And the reason being is because prevention and harm reduction are just such big areas. And we wanted to make sure that harm reduction was getting the attention that it needed, along with prevention. So we held that meeting on April 5th, and mostly it was presentations and then recommendations from those presentations, and some examples of the presentations that we had as part of the harm reduction were a bad batch application, a quantitative drug checking for people who use drugs, drug checking for people who use drugs in our state, harm reduction supply shipping efforts, post-overdose response teams, alternative pain treatment, safe smoking and safe smoking supplies, and then the role of the community health worker and harm reduction. So really good and informative meeting. One of the marching forward orders we had gotten from the Attorney General was he felt that many of our efforts in last year were really focused on opiates, and he wanted us to make sure that we expand it and didn't just focus on opiates. So that was a lot of why you saw the safe smoking and some of the attention to vaping and those sorts of things as well. And the drug checking not just for opiates, but for any drugs. So that was a really successful meeting. The agreement was that the recommendations that came out of that harm reduction meeting would go to that prevention subcommittee, and they would work on those recommendations. So our next meeting for larger surge is going to be July 12th. And if anyone wants to attend that, please do, because it will be informative. One of the things that we're doing is having an update on legislation that we're following, because as was highlighted, there were a couple of legislation that were suggested by the Attorney General's office, or that the surge had made recommendations on, or any that would be of interest to us. So we will have that. It's not going to be a comprehensive update, but it will be an update on what we had made recommendations on or were following, so that we can find out the status of those. And I'll give you the one example. One of our committee members said that these aren't one and done, right? So like the role of the community health worker and harm reduction, that's something that we may not see, and I know they have been working on for like 10 years. So that we want to follow that, and if it doesn't pass, or if we need to make amendments to that, so that we can continue to follow it and can maybe add it onto our list for recommendations for next year's report as well. So that's where we're at on that. All of our subcommittees will do a report out at that July 12th meeting on where they're at. So we're starting the whole process over again and looking at our recommendations that we had made from each of the subcommittees, and then bringing forth new recommendations as well. So we're really early in that process. I think each of the committees does already have some recommendations, but we'll formalize that on, if we need to revisit some of the recommendations that nothing happened with them, or if we want to amend them, and then our new recommendations. So that's where we're at. And you all, again, are welcome to come to any of our subcommittee meetings as well, because that's usually where most of the work is getting done and then pushed up to the larger surge. And like I said, those typically meet every other month. We do have all of these posted on the Attorney General's site under our surge website, with all of the past meeting and subcommittee meeting minutes, and then with the information on the upcoming ones as well. If anyone has any questions, I'm happy to take those.
Good, thank you, Dr. Kerns. Do we have any questions or anyone looking for information or clarification from Dr. Kerns? I am not seeing anyone. I'll say I appreciate you showing up and giving us an update, and also the commitment and enthusiasm that your committee has. It's good to see that things are coming along and that you guys are taking into consideration a multifaceted approach or perspective on what this remediation is going to look like.
Thank you, and thank you for the time today.
Garrett, can you confirm that we have no one that is interested in comment or questions for Dr. Kerns for me, please?
There is no questions for Dr. Kern.
Great, thank you very much. All right, at this time, I would like to move this meeting from agenda item number 5 to agenda item number 6, which is an informational presentation on State Opioid Response Grant from Michelle Berry and Morgan Green. That's still happening, right? I don't know if I see them. Oh, okay, I got Michelle here.
It is. I'm going to share the presentation for Michelle. Hold on. Great, thank you. Can you hear me?
Yeah, we got you.
Okay, perfect. Thank you. All right. Thank you, Chair Sanchez and members of the committee. I've been asked to come here today and give a brief presentation on the State Opioid Response Grant. And my name is Michelle Berry. I'm a senior project manager with the Center for the Application of Substance Abuse Technologies at the School of Public Health at the University of Nevada, Reno. We are the prime subaward recipient from the Division of Public and Behavioral Health Substance Abuse Prevention and Treatment Agency to assist with getting the state opioid response dollars subawarded out into the community. Next slide. This is CASAT's role for the State Opioid Response Grant. We help to deliver the deliverables outlined in each of the iterances of SOAR, draft and issue NOFOs, review all of the applicants along with members on an external review committee, execute subawards, monitor subrecipients,
compile reports that go back to the federal funder, develop training materials, serve as a distribution site for naloxone fentanyl test strips, collect Government Performance Reporting Act data and other evaluation metrics, organize media campaigns, and fund the Zero Suicide Initiative and adopt SBIRT, which is Screening, Brief Intervention, Referral to Treatment. So next slide. So as you can see, the State Opioid Response Grant started as a state targeted response grant in May 2017, and there are concurrent years of funding. So sometimes you will have a iterance of the State Opioid Response Grant, and then during a no-cost extension, you'll have the first year of the next response grant. So these are discretionary dollars issued by the federal government, and they are provided in 2-year increments with a possibility of a no-cost extension. So we are currently in the no-cost extension for SOAR 2, that started in October of 2022, and year 1 of SOAR 3, which also started in October of 2022. SOAR 3 year 1 has been delayed with distribution of funding because we need IFC approval and authority for the state to use the funds. But we are currently applying, the state is currently applying for a continuation of SOAR funding. So there would be a year 2. Next slide. These are the service development and focus areas of SOAR through the State Targeted Response Grant, SOAR 1, SOAR 2, and then SOAR 3. Each of these build upon each other. The dollar signs that you see underneath each iterance of the award is the amount of money that was distributed into the community for community-based providers to provide services under the deliverables outlined in the State Opioid Response Grant. Next slide. So SOAR does have a number of target areas that we look at. The primary areas for SOAR are looking at serving individuals with an opioid use disorder. And then in SOAR 2, it expanded into serving individuals with a stimulant use disorder, along with an opioid use disorder. And then SOAR 3 expanded services into primary prevention. But these are the main target areas that SOAR has looked at. Next slide. These are all of the subaward recipients that have received dollars from SOAR. The asterisk indicates organizations that no longer receive funding because they have either completed the project, met sustainability with the dollars that they have received, or have found themselves on corrective action. Next slide. I was asked for another committee meeting to report back on funding that has been targeted towards direct service. And so this is what, from the origination of SOAR through SOAR 2 year 2, how much of the dollars have been spent in treatment. As you can see, 80% recovery support, 11% early intervention, harm reduction, provider training, and towards media campaigns. And the majority of the dollars have been spent providing direct treatment services as outlined in the Notice of Funding Award. Next slide. This also looks at funding by direct service type and the distribution through withdrawal management, residential services, outpatient, transitional housing, opioid treatment programs, and recovery support. You can go to the next slide, that's fine. And then this is a direct service breakdown. So this is the number of treatment episodes that we've provided under withdrawal management, the medium length of stay in days, the range that individuals have stayed within organizations for the particular treatment type, and the average cost per client that we've been paying out of SOAR. And so Nevada, in reference to what is being provided nationally for treatment, is still well under the national average. Next slide. So this is our naloxone distribution efforts under SOAR. So there are other funding mechanisms that do response grant. So from the point where we were able to begin distribution of naloxone in February 2018, and we stopped it in March 2023, for this data set, we've distributed 68,484 kits. Reversals reported has been over 2,000, and kits distributed to law enforcement and first responder agencies over 11,000. Next slide. And then with fentanyl test strips, SOAR didn't start their fentanyl test strip distribution until March of 2022. Southern Nevada Health District was able to launch in December of 2021. But this goes through the distribution plan with priority service areas that receive the fentanyl test strips, and then a number that has been distributed, and then through the on their distribution as well. Next slide. We also fund a neonatal abstinence syndrome project through the Perinatal Quality Collaborative, known as ASTO Omni. Dr. Kamiar was instrumental in helping to develop these reference guides for both inpatient and outpatient care. Next slide. And then we do fund emergency room-based peers that have been located at Renown and the University Medical Center in Southern Nevada, and looking at individuals that come into an emergency department and then are discharged, getting them to care immediately, or getting them into the network of peer recovery support. And so these numbers outline some of the successes that we've had with this program. Next slide. And then we've also had the opportunity to fund the Zero Suicide Initiative, which is a collaboration within healthcare systems. And so we've completed 2 rounds of a learning series looking at 21 healthcare systems, and then transitioning into communities of learning and communities of practice. Next slide. And then we've also funded various media campaigns that have been executed statewide. Some of these have been in collaboration with OD2A and other projects that have been bringing opioid dollars into the state. But we've typically looked at anti-stigma campaigns, naloxone awareness, how to seek and find treatment, and recovery-friendly workplace initiative. Next slide. Just some of the awards that the media campaigns have received in 2022 and 2023. Next slide. So I was also asked to talk briefly about certification, and CASAT does certify on behalf of the state prevention programs, coalitions, and treatment providers statewide. All certification is based on the Nevada Revised Statutes NRS 458 and subsequently NAC 458. And any provider receiving funding from the Substance Abuse Prevention and Treatment Agency, where SOAR also lives, but any funding that comes from that particular agency needs to be certified. And so also for individuals seeking reimbursement as a Medicaid provider type 17215. And then our team will look at the organization as a whole, instance, should there be anything that just needs a little bit more finessing or fine tuning within the service delivery of an organization. And then there is a quality assurance model, and we've been doing these services since 2006. So this is larger than SOAR. This is for any organization that is looking at providing substance use disorder services. Next slide. This just gives an overview of the number of programs and sites that do exist in the state that are currently certified. Next slide. And so I think I also wanted to give an update on the opioid antagonist saturation plan. As part of SOAR 3, we were required to put together a saturation plan on what that would look like to saturate the state. Oh, is it not moving forward? Oh, thanks. So we had set a goal, working in collaboration with all entities, providing opioid work, OD2A, Southern Nevada Health District, community-based providers, on what it would look like if we could saturate the state, and then looking at having an opioid antagonist present at 80% of witness overdoses, and this is based on SAMHSA guidance. For full saturation throughout the state, it would be 115 units distributed annually. And then between September 30th and 21 and September 29, 22, Nevada distributed 27,916 kits. And then this would be our distribution goals over the next 2 years. Year one, which is the current year, 40,000 units. And then next year would be 55,000 units. Next slide.
Michelle, I'm so sorry. This is Elise. I just want to clarify. So is full saturation 15,000 units or 115,000 units?
115,000.
Okay.
Annually.
Okay. Cool. Thanks.
Next slide. So the targeted distribution and communication strategy would be improving relationships with industry, focusing on entertainment to expand more targeted distribution, expanding jail-based distribution and relationships with criminal justice agencies, initiating emergency room opioid antagonist distribution. And this could be in partnership with the emergency room bridge program and zero suicide and peer supports within emergency departments, increasing availability of harm reduction vending machines, and working with the Attorney General's office to reduce barriers to access through state legislation. And then target underrepresented populations, increasing production and distribution of appropriate translated materials, continued partnerships with OD2A to focus on group outcomes to tailor approaches, expand partnerships with community-based providers, recruit faith-based organizations, and engage with the Minority Health Equity Coalition for guidance. And this is our distribution timeline broken down into quarters. So we're currently in quarter 3 of this project, and we're moving, and we're on target for meeting our distribution timeline. We can provide you with a better graphic. Next slide. And then our progress based on the timeline. Next slide. And then again, this is through March of 2023, but we have distributed over 17,000 units, and our annual goal for year one is 40,000. Next slide. And this outlines the number of distribution sites that exist per county. Next slide. In March of 2023, naloxone did become available over the counter. It's not currently available. There's not enough product to meet the demand of getting it to over the counter yet. And we're still unsure if Narcan will remain under insurance coverage. So there are still some questions that have been determined, and the cost of over the counter has also not been determined. So we're anticipating release in Nevada based on the manufacturers, conversations we've had with manufacturers, to come sometime this fall. And so as we know more about cost and if this will be covered by insurance and when it does become available, we'll be sure to let this committee know. And then there are other opioid antagonist medications that are being expected to receive FDA approval, and we continue to follow that. And just some considerations. Currently, the State Opioid Response Grant has been the primary funder for the purchase of opioid antagonist medication. We recently had an infusion from the OD2A project to purchase both injectable and nasal naloxone. So we're really grateful. And then looking at AB 156, which passed in June 2023, it provides an account that the state can use for projects that are able to purchase an opioid antagonist to directly put money into the account that the Division of Public and Behavioral Health can then use to purchase naloxone. So hopefully the purchase is going to be made a little bit more easier with these different funding streams being able to come together and distribute into an account. Next slide. SOAR 3 did release a notice of funding opportunity that would cover 3 months worth of funding, again, because of how late our funds were made available. These were the target areas of organizations that were selected for the July through September, 2023. I think I moved those dates around. But, and then the counties in which the organizations are. I didn't put the names of the organizations yet because we're still in review with budgets and finalization of funding. But as soon as those are completed, I'll present a list of the organizations that were selected for funding.
Thank you, Michelle, for your presentation. That was a lot of information and a lot of good information. I do have one of our committee members with a question. Am I coming through okay, or am I breaking up? Okay, thank you. Looks like Jessica Barlow has a question. Jessica, are you there?
Chair, she's coming back through. She somehow is back into the attendees, so she's just been given presenter rights. She should be able to speak now.
Jessica, I believe if you...
I had briefly to draw attention that I was dropped from the meeting, so I apologize for that background. I'm not sure what happened, but just didn't have the ability to unmute or join chat.
Okay, so no question or comment for you for Michelle, is that correct?
That is correct.
All right, thank you, Jessica. Elise?
Awesome. Thanks, Chair. Hey, Michelle, it's really good to hear from you. So I had a question, two questions. One is specifically about the direct service breakdown section. I think that's really good data. I don't know that I've ever seen this before, so I'm really happy to see it broken out this way. And I just want to ask, you noted that the spending for services is well under the Nevada average.
It's well under the national average.
Or the national average, sorry, the national average. The spending in Nevada is well under the national average. So do you have any idea as to why that may be? Is that because our reimbursement rates are so low? Or is that because we don't have as many people accessing treatment services?
I don't know. In just putting this together and looking at what is spent nationally and what Nevada has spent using SOAR dollars, that's what we were able to discern for those particular levels of care, withdrawal management, residential, transitional housing, that the per client rate was just less than what was established nationally. I'm not sure what factors contribute to it, but it would make a fascinating study.
And then just to confirm, so the national average for treatment on what other SOAR jurisdictions have spent, and SOAR just covers treatment for people who are or underinsured, is that right?
Covers treatment for uninsured, underinsured, and for service areas that don't have another reimbursement mechanism.
Okay, excellent. Awesome. I agree that it would be really interesting to dive into this a little bit more and kind of understand why Nevada, it seems to be reimbursing under or for the total program. That's really fascinating. Thanks for breaking the numbers down like that. And then my next question is, it looks on the naloxone saturation plan, it looks like for full saturation, it would be 115,000 units. And the goal for the next 2 years, I think, is smart given where current distribution is. But is there anything that you think that we as a committee should think about or prioritize for our funding recommendations that could make it easier for increased ramp up of naloxone distribution in the state?
That's a good question. I don't know. A lot of questions have been coming regarding what it looks like for over the counter. But as far as ramping up efforts, I think also continuing to look at like priority populations, and then distribution amongst priority populations. But those would be my only recommendations at this time. As we have more, then I'm happy to come back and share.
Okay, cool. Thank you.
Thank you for your questions and comments, Elise. I appreciate that. You bring up some good points, and I kind of had the same ending question as far as how could this committee make recommendations that supports the naloxone distribution or that saturation plan. So that's something that I think we'll need to keep in mind for sure. Seeing that we're under what 80% would look like, and that it looks to me like it's going to be a tight timeline to meet the year one goal. Dr. Kamiar?
Thanks, Chair. Hey, Michelle. Awesome presentation. Thank you. Comment. I actually think like a couple weeks ago they approved the new nasal spray for that other antagonist.
Oh, yes, thank you.
Yeah, but who knows what'll happen with that. But going back to the saturation. So Michelle, do you know if that includes like that goal? Does that include prescriptions that are picked up for Narcan, for example, or antagonists, and even like pharmacy distribution that is not through a prescription, but it's just like pharmacist distribution?
No, this is strictly for number of units that need to come out of our program.
Okay. How do those numbers play into the saturation? I've never heard of the saturation plan. Sounds great. But how do those play into, or is this saturation totally independent of everything else? It's just for, hey, for like Narcan distribution sites, this is what we're shooting for.
I'm not sure if I keep feeling like I'm having technical difficulties, but I think this might be on Michelle's end. Michelle, did you hear
Can you hear me
the
now?
message? Yeah, there we go. We got you.
That I'm sure that number will change. We have to update the saturation plan here in a couple months again, but that's what we were able to identify at the time that we needed to write it. This is what SOAR funded naloxone getting out into our communities looks like. No, we didn't look at anything for what is being filled by prescription.
Thank you.
Thank you, Dr. Kamiar. And yes, again, thank you, Michelle, for your presentation. I did have another question / comment on the partnership with the hospitals. I noticed that the hospital in Carson City was not included on that, and I'm just looking to see if you have any background information as far as what that relationship looks like, if that's something that's being pursued, or where we are at, or where you guys are at with the response to having peers in the Carson Tahoe Hospital, or at least some type of follow-up with.
Oh, sure. So we have been looking at additional hospitals to embed peers, also not only in the emergency department, but also provide the team that will work with individuals upon discharge. But those are the two hospitals that we've piloted the program in.
Okay. So is that something that you guys will be working on in the future? And is there a timeline?
Right. We've also been working with a number of hospitals on emergency room induction. And it's really based on hospital readiness, their desire to want to expand services. So we just continue to be available. So, but it is something that we'll continue to focus on in SOAR 3.
This is Elise, Chair. I wonder if there's a way, and I know that Delaware has done this, and they're a much smaller state, but they have used grant dollars to incentivize hospitals to do programs like this. So I wonder if that's not something that we can look at with our settlement dollars. Like, I don't know what incentivizing hospitals would look like if it's a payment, a payment for, we pay all the pay the overtime for people to get trained, or I don't know what that looks like, but maybe that's something we can look at, is helping to incentivize growth of expansions of programs through incentivizing with dollars. Thanks.
Yeah, no, that's a really good thought there, Elise. And really, in my mind, I would imagine the future of all of the hospitals in Nevada be held to a standard to include these after postvention overdose experiences, and then also providing the foundation for supports that are needed for folks that are going through these overdoses and then end up at the hospital. So I understand that we have to have hospital buy-in, but I would imagine that there's a version of state cooperation or pressure to get these programs started and then actionable soon rather than later. So hopefully it's something that we can keep on our radar and something that we can think about as we move forward, and any existing connections that we have in our communities to bring it forward. Because I know it's on my mind, and that's why I specifically brought up Carson, because I live in Carson and my community is in Carson. And I've been keeping an eye on it, but it seems like it's moving kind of slow, but maybe I just don't have the information. And also maybe it is something that this committee can keep in mind when it comes to recommendation of the funds going out into the community and what that would look like to help develop these postvention teams or responses to overdose within the hospital systems themselves. Dr. Kerns?
Thank you. This doesn't answer all of the questions that you had, but I just wanted to provide a little bit of information. In our last surge response subcommittee meeting, we had a group of presenters talking about the bridge program. And when I say the bridge program, it had a lot of components. It was for down here in Clark County through the Valley Health System, and then also Las Vegas Fire and Rescue and their community paramedicine program. So what they were looking at is a couple of things, the ability to have inductions done in the emergency departments, and then also to provide free or naloxone free to people who come in who have overdosed without a prescription, because we'd heard from many of our committee members that that was really inhibited a lot of people from getting naloxone, is getting a prescription, having to go and getting it filled. So the ability to provide naloxone to people free without a prescription in the emergency departments that have come in with an overdose. And then the specific program that was being looked at down here that was presented on was this community paramedicine program, that if they've done an induction, that group would go back up and follow up. And if needed, also to provide buprenorphine to people before they could get into a treatment program. So I think part of this is getting an advocate in the community who's doing it. And we do have that with Dr. Morgan down here with the Valley Health Systems and trying to get these programs going. And then, you know, almost like a pilot, it's worked here. So then taking it through their connections and through the hospital associations and those sort of things. So just an update to you all on what we heard in our response subcommittee group meeting.
Great. Thank you, Dr. Kerns. I do not see. Does anybody else have any comments or questions before we move forward? All right. Again, thank you everyone for your comments and questions. And Michelle, thank you for bringing this useful information and presenting it to us at our committee meeting. We really appreciate it. Now we will move forward from agenda item number 6 to agenda item number 7, which is for possible action to take votes on the advisory committee for Resilient Nevada officers. Per our bylaws, the first meeting of every calendar year, we will take votes on open positions for the committee. That being said, I'm still open and willing to serve as chair if that's what this committee would like. If we have anyone else that is interested in volunteering, or anybody that we would like to recommend, I forget the word, to step up as chair or to be chair, that is something that we can do also. So at this time, I would like to start with the chair position, see if we have anybody that is interested in being the chair, or anybody that would like to, what's the word I'm looking for? I'm so sorry.
Nominate.
Nominate.
Are
Thank
there any
you.
nominations?
Is it nominate?
Yes, I'm so sorry. Well, I am having technical difficulties, so maybe that's why the word just left me. But do we have any nominations for chair? And again, just to be clear, I am willing to continue to serve if we do not. Any thoughts or comments on chair position for the committee?
David, this is Pauline. If you're willing to serve, I'm more than happy to nominate you for that position.
This is Elise. I second the nomination to continue David Sanchez as chair, who's done a great job, and it will be great to have continuity in leadership as we go into year 2.
Ooh, good point. At least I did not think of that. And yeah, I was wondering what this would look like, but absolutely I am able, willing, and interested in continue to serve. I believe at this point, and do we have any other nominations for chair? Just want to leave it open. I don't want to hog the spotlight at all. Okay. Crickets mean that we should take a quick vote to the nomination and second for the motion to continue this position as it stands currently, as myself as the chair. Can I get, or all in favor, please give us aye in favor for myself to remain the chair of the committee.
Aye.
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 Do we have any nays for this nomination? Any abstentions? Okay, it looks like I will continue to be the chair for this committee for the next 2 years, which I'm really excited about, and I really appreciate all the support, which I need a lot of, because I'm pretty new to this, and this is my first committee chair position, and I'm grateful to have this responsibility. Moving forward, we will look at the vice chair position, which I believe, Carissa, if you want to speak to your role in that position and moving forward.
Yes, thanks, David. This is Carissa for everyone. I also had just let the team know I would be willing to continue serving as vice chair if no one was else was interested. I support David for the meetings. If he were to be absent, I would run the meeting. We convene with the state administrative team, before the meetings, just letting you know what the vice chair role currently consists of. And, we help coordinate to make sure we can run a smooth meeting on these days, but I'd be happy to continue serving in this role. Thank you.
Thank you, Carissa. Do we have anybody else that is interested in nominating themselves or nominating someone else for the vice chair position? Or do we have a second or a nomination for Carissa to continue her position as vice chair of this committee?
This is Jessica Bartlett. I'll nominate her to continue her role.
Okay, thank you, Jessica. Do we have a second for the nomination or another individual that would like to nominate someone else or themselves?
This is Pauline. I'll second it.
Thank you, Pauline. At this time, correct me if I'm wrong, Garrett, but I don't see anybody else with their hand up or making another nomination for the position.
That is correct. No other nominations.
Thank you, Garrett. At this time, I'd like to call to vote for the secretary position of the advisory committee for Resilient Nevada for Carissa Loper to remain the vice chair of the committee. And all in favor, can I get an aye from you?
Aye.
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 I also. Any, I don't know if I'm allowed to vote, actually. Sorry about that. Any opposed? Any nays? And any abstentions? All right, it will pass that Carissa Loper maintains her position as vice chair of this committee. And again, thank you for volunteering and supporting us in that role, Carissa. You've done an excellent job, and I definitely appreciate having you as part of the team that helps guide this committee. We do have a secretary position open, which we have not had a secretary for this committee since its conception, but we are open for nominations for a secretary, and so far we have had excellent support from the state support team that has pretty much been filling the role of the secretary in this committee. Do we have anybody that is interested in volunteering for this position or any nominations for this position? All right.
David, this is Pauline. So with the secretary, what's the workload? If the state office supports, then what's the workload?
That is a good question. It is in our bylaws, but the secretary is responsible for standing committee reports and helps with the minutes, that the minutes are taken accurately and approved in a timely manner. And again, so far we have had state support getting those roles done, and it has gone well. And I don't want it to seem like the state is just going to step out of that support if we were to nominate a secretary, but that would be an option if somebody wanted to nominate themselves or nominate another member of the committee to fill that role.
I mean, I'd be willing to do it if the state doesn't step out.
Don, correct me if I'm wrong, but it's the same support with or without the secretary position, correct?
Yes, correct. The ACRN will have to be writing their report this year or next year. And so I think the secretary will have a little bit more of a hand in that than the state coming in. And then as well as if there are any subcommittees, the secretary would be in charge of doing any of those minutes instead of the state staff coming in and assisting with that.
So that being said, it could be quite a commitment to show up because we don't know what the future is going to look like as far as those subcommittees. And I'll just say that the previous year's report to the director wouldn't have been able to move forward without the state support, basically crafting that and having it approved and reviewed by the committee and myself, the chair, and the vice chair. So it is a commitment and it does entail some work. So keep that in mind as you nominate yourself or someone else. But again, also keep in mind that the state staff has been excellent in providing the support and guidance that we need in getting our roles and responsibilities done.
This is Dawn, and just to confirm, we won't be stepping out. So whoever the secretary is, if we need to work hand in hand, we will work with you.
All right, that I'm willing to do it after hearing that.
Awesome. That's great. Thank you so much, Pauline. So the process is that we can have committee members nominate themselves. So at this time, we'll need anybody else who's interested in nominating someone or themselves, please speak now. And if we do not have anyone, we will need a second on the nomination, and then we will need to vote on the position.
This is Carissa. If no one else, I will second Pauline's self-nomination for the secretary position.
Awesome. Thank you, Carissa. I'm looking through and I don't see anybody else with their hand up or interested in nominating someone else. So at this time, I would like to take a vote. All in favor of appointing Pauline as our secretary of the ACRN. Can I get an aye from you at this time?
Aye.
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 So, any nays? Anybody opposed? And do we have any abstentions? All right, great news. Good movement in the committee. Pauline Salas is now our secretary of the committee. Thank you so much, Pauline, for being here with us and supporting us. All right, at this time, those are the actionable items that we had in this agenda, and for agenda item number 7, I will move us to agenda item number 8, which is informational and discussion about the meeting schedule and possible agenda items for our next meeting. Again, briefly in agenda item number 4, I talked about getting the committee's feedback as far as for up until January 2024 over the next couple months. Do we want to meet every other month or every just 2 more times? We'll do quarterly every 3 months to get informational presentations from the state and other parties that can help us determine what our recommendations will be or make decisions moving forward with the litigation funds. And I'd like to get your guys' feedback on this. We have 2 options. We have every other month or every 3rd month. Elise?
So, Chair, my option and my preference would be every other month, just since there's so much that is being funded and used that's not necessarily tied to a NOFO yet, like the test strips, the distribution of all those things. I just want to make sure that that if there's something that the state finds needs support, with standing up distribution of something, um, or what else it might look like, that we can be responsive. So that's my personal preference.
Great, thank you, Elise. I appreciate that. And I'm leaning towards that as well. I'm with you on that. I think that although sometimes presentations can get a little repetitive or tiresome, it's important for us to get this information at this point of where we're at in the committee. So having 3 more opportunities to meet for 2023 is going to be something that I also favor. Pauline?
I support that also. I like that idea.
Great, thank you, Pauline. Carissa?
Thanks, Chair. It's Carissa. So I support every other month as well. I wanted to make sure, did I miss you saying that then we would start monthly again in January 2024 as we prepare to write our report to be submitted by June?
Yes, you did, and I was kind of going to go over that after we get the bi-monthly or
I
quarterly months.
apologize.
No,
Sorry.
no, you're
Okay.
good. No, you're good. I mean, it's good that we talk about it if we're thinking about it. Yes, that is going to be an important thing that I would advocate for, is that we move to monthly starting January, because we have our report due to the director, I believe June 30th of next year. So we'll have an opportunity to meet 5 times if we meet monthly starting January 2024 to get that report ready and ready to submit by June. Do we have anybody else interested in comment or questions, clarifications for our schedule as a committee for the rest of 2023 and moving up until our report is due in June of 2024? How do you guys feel about that? Does that sound like something you're willing to commit to and able to show up to? And then also I want to talk about scheduling days and times, because I know that we have folks on the committee who need to have this information well in advance to plan and prep. And I really do want to emphasize the commitment and importance of participation in these meetings. So I am willing to adjust or come to some type of agreement that can get us all able and available to attend the meetings moving forward. I have Malika. The floor is yours.
Hi, Malika Tostin. Hi, I agree. I would definitely like to meet every other month.
Great. Thank you for your input, and good to have you with us. Thank you for sharing. Anybody else? All right. So from the limited response that we've gotten so far, I think it is going to be prudent to continue meeting every other month. So that means that our next ACRN meeting will be scheduled in August, and then we will meet 2 months after that. I think we went through some what are they called? Questionnaires to determine which time and day would be best for this committee to meet. So right now we will get a tentative email out for the schedule and meeting in August, and we will try to come to an agreement on when everybody can attend and participate for that meeting in August. And the state team will help us get that email out here in the next couple of days or week. I have one hand up.
It's me. It's Brittany. I just
there
had
you
a
are.
quick question for the joint meeting that we have with Surge. What I know you said is that in July or is that next week? What day was that again?
I think it is June 26th is what I have.
June.
So this is the cross-sector task force meeting. And I know that these ACRN meetings in conjunction with the cross sector task force meetings kind of puts a lot on our table. But I think again, the subject matter experts that we have on this committee are going to be integral in helping come up with plans to respond to overdose outbreaks or a massive overdoses, and coming up with guidance towards how the litigation funds are going to be spent. So if we can get attendance or a heads up that people won't be able to make it to these meetings, I would appreciate it. So yes, Brittany, the meeting for the cross-sector task force again is on June 26th of
And
this year.
What's the time?
That's a good question. Let me see if I can bring it up real quick. Give me 1 second.
It's 10 a.m.
Thank you. Thank you, Garrett. 10 a.m. the 26th of June.
Will we be getting a meeting link for this one as well? Or?
Yeah, I think
That should be coming out this week, you guys.
okay. Great. Thank you, Garrett. Yeah, and I guess that's why I had it on the agenda or had a note to myself is to make sure to mention that it is coming up, but the state team will get that out this week, the invitation to that meeting. And I will ask also, or just, make it a reminder that we will try to get these meetings and times sent to you well in advance so that you can schedule out your calendars to be able to attend. And I think that being said, do we have any more questions or comments or any clarification needed on the meeting schedule or the agenda items for our next meeting? Anything that you guys want to see on there? Anybody you want to hear from? Any questions or concerns? I have Elise.
So I would like to, in the next couple months, talk about, if we could, the mass spectrometers. So what the distribution of those is going to look like, and then also maybe we can talk about the distribution of the mass spectrometers in conjunction with work. There was a bill, the Attorney General or the governor's crime bill, one of them included funding for testing. And then I think there was a study. So maybe kind of understanding like what's going on with drug testing right now, and what distribution is going to look like in the next couple months would be awesome.
That is perfect. Thank you so much, Elise. Yeah, and so the issues that are close to your heart, the things that matter to you or that you see as upcoming barriers or to access to service or issues with the population that we aim to serve and support through this committee, please bring them up and keep them in mind and mention them so that we can advocate for either an informational presentation or just a conversation about how this committee can guide funds going out into the community to support and keep safe the things that matter to us. So yes, I believe that that is something that the state team can help put together or pull together people that can give us some information and background on what that looks like. And then I know from a personal perspective, kind of similar to what Elise said, I'm interested in finding out what this committee could do to fund or support policy, procedure, and protections towards the purchase and distribution of these mass spectrometers. The point was to keep people alive and keep them away from overdose. but it seems like there's going to be some conflict or friction between that intention and the possibility of over criminalization and what's it called? Criminalizing addiction or the use of opioids in a way that is not conducive to what we're trying to do here. So thank you. Does anybody else have any questions or comments in regards to the meeting schedule or future agenda items or presentations, informational things? Brittany, I have you there again.
Yes, I'm sorry. I have another
Oh, no.
question. Regarding the subcommittees, when should we start meeting for those, and what would you guys like to see come about from the subcommittees?
So yeah, I had a very similar question, and I think I correct me if I'm wrong, Don, but I think that the subcommittees that we have been broken down into or parsed into are directly related to the uh the task force, the cross-sector task force, and not specifically to do with the ACRN. Is that correct, Don?
The ACRN does not have any subcommittees right now. Might be a recommendation to open up your bylaws and make sure those are up to date with whatever you guys are doing right now.
Okay. Brittany, how do you feel about that response? Does that clarify enough?
I think so. The clarification is the subcommittee is from the task force, correct? Okay. I just wanted to
Yes.
be certain. I just noticed it was a lot of the ACRN members, I think, that had signed up. So I assumed it was solely for ACRN.
Yes, so me too. I'm right there with you. Like that's exactly what I thought. But then after a little bit of clarification, and then that kind of highlights too, would the ACRN need these subcommittees to address the same things that we are addressing inside the task force? So I guess that's something to think about. But I believe what Dawn is pointing out is that if we do have issues or concerns or special projects or a direction that we want to go in, we can create a subgroup within the ACRN to target those issues. But I think as of now, the email that we received that groups us into these places that we would be willing to advocate for or do some work with are specifically tied to the cross-sector task force at the time.
Thank you.
Dr. Camia?
Yeah, I guess for agenda items, and I may have missed this, so please correct me if I'm wrong, but I guess something along the lines of aligning or understanding what it is that the Surge is doing. I mean, I go to the Surge website. Admittedly, I don't attend the meetings, but when I go to the website, it looks like they have a lot of really good presentations, like subcommittees, work that's being done. That's awesome, and potentially aligns with, you know, like ideas that we have and whatnot. But I just don't know exactly, right? I can't put my finger exactly on everything that's happened, what they've put together, where they're headed. So something along those lines. And I would say maybe even potentially in the timing of our meetings. I know we talked about having a meeting every other month, but however, that may need to align with, like, Surge has a meeting, they have 5 really cool presentations, and then, you know, we can get a synopsis of what that is as a 10-minute agenda item in our meeting. So ours would have to happen 2 weeks after theirs, you know, just sort of taking that into consideration. But I would like to know everything that they've done and what they continue to do.
Yeah, good points for sure, Dr. Camera. And I think that this is something that we touched on before and noticed before as how involved and what direction the Surge is going comparatively to us. And so, yeah, I see that as a great opportunity to add to a future agenda item in our next meeting. And I think the state team can help schedule that meeting around or after the surge is done, possibly. I don't know. I know it's been talked about. So I guess what we're looking for is a recap of what is being done through the surge or how their work connects to our work, and if there's anything that we need to keep up to date on. Dawn, do you think that's something that we'll be able to incorporate into our next meeting?
This is Dawn. Yeah, we have Dr. Terry Kerns here primarily at all of our meetings, so she will be able to do a recap just like she did today.
Awesome. Thank you. Elise, do you have your hand up again, or is it still up? I've been lowering hands, but I don't want to do it if it's just up as a new one.
Sorry, no, I forgot to lower it. Thanks.
Okay. Okay. That looks and sounds good as far as what we will be doing at our next meeting and what we're looking for in the following meetings before the end of the year. If we have no more questions or comments for agenda item number 8, I'd like to move to agenda item number 9. Does anybody have any closing remarks or questions or need any clarification on agenda item number 8 before we move forward? All right. Looks good. I will now move the meeting to agenda item number 9, which is public comment number 2. Again, in consideration with any others who wish to speak, please keep your comments to no more than 3 minutes. Do we have anybody available or interested in speaking as part of public comment number 2?
If you're an attendee and you would like to speak in public comment, can you just please raise your hand?
Thank you, Don.
I see no hands raised at this time, Chair.
Right. Thank you. Well, with no more folks interested in public comment number 2, we will go ahead and move to agenda item number 10, which is the adjournment of this meeting. Thank you everyone for your attendance and participation, and I look forward to seeing you in a couple of months. If you have any questions or comments, please feel free to forward them to myself or our secretary or vice chair or Dawn and the state team, and we will do the best we can to respond accordingly and appropriately. Thank you again, and have a great day.
Thanks, David. Bye.